our various jobs, different departments intersect daily, and it's important for professionals to learn to work with others, especially those in the healthcare industry. Oak Point University's Interprofessional Education Scholars Program helps students get that real-world experience. Assistant professor and clinical support specialist Jody Falk shares how it all works.
IPE stands for Interprofessional Education, and what it is, it's the students learning about within from each other. Nursing learns nursing practices, radiography learns radiography practices, but to combine them, that's what they're going to do in the healthcare setting. And for best patient outcomes, you have to know how to do that.
Just a little, huh?
When the students sign up for this program, they're able to do different modules that would help them understand the IPE competencies. So these modules are self-paced and they're designed for the students to get a deeper understanding of the values and ethics different groups would have, so nursing versus radiography, the communication piece that needs to happen between both programs, also the teamwork, collaboration, and then roles and responsibilities. The Scholar program is in 3 different simulations. So each simulation is going to mimic a patient going through a different procedure. They will start off the patient in a preoperative procedural setting. They're going to check you out, make sure you're ready for surgery, consent forms are signed. And then what they'll do is they'll take you from there into the procedure room to do the procedure scenario as well. And then finally, when the patient's done with the procedure, they would go into a post-operative setting. So they'll check to make sure that the patient's okay, that the incision site is good, and they'll check them for any changes that might be happening with them.
Okay, we'll check on you, and we'll get you a snack, and we'll get your mom in, okay?
Okay.
And we create little situations along the way. So we would have an ethical situation, or a roles and responsibility dilemma, or a teamwork breakdown, or a communication breakdown. And we build all those things in, so when the students are done with each scenario, we go and we talk about them. And we recall every single thing that happened, like in detail. And we have facilitators in there, so we kind of help facilitate that discussion, but we're really just there to facilitate, not to have it. The students are having it amongst themselves. This is something that will help build your expertise, your level of knowledge. You'll have information that you wouldn't be able to gain otherwise. A lot of students who have come out of this program who go into an interview, they can talk about this experience that they had, and it sets them apart because this isn't a normal situation that you get to have in your education process. We've had students when they finish who have been able to go and work in the operating room right out of school, which is not usual. We've also had x-ray students that were able to work in a cardiac catheterization lab, again, which isn't normal. Usually they want you to have some experience working in a hospital setting to get an experience like this and to get this understanding. So when they do this, they can sell it to their prospective employers in a way that gives them an advantage. It's all designed about creating better patient outcomes, which is what we want as healthcare professionals. That's who's centric to us. Plus, another benefit is the students have come back and said, I'm so much more engaged. I feel valued by my employer every day and the people I work with too, especially if they work in a team like this. They understand that the value of this is so important for them as well.
All right, get those phones ready. Scan the QR code on your screen for more information about Oak Point University. You can also head to the website oakpoint.edu or give them a call.